Partner and Engagement and Outreach to Address Community Needs webinar. To allow for additional signees past the hour, we will start the webinar in a few minutes. Good afternoon. Thank you for joining today's 2021 Cross-System Partner Engagement and Outreach to Address Community Needs webinar. I am Demetrius Thomas, the Deputy Program Director here at the Council of State Governments Justice Center. Today's webinar is funded by the U.S. Department of Justice, Bureau of Justice Assistance, BJA, and done in collaboration with the Institute for Intergovernmental Research, IIR. To give you an overview of today's webinar, first I will introduce the speakers. Then there will be a brief overview on the Council of State Governments Justice and Mental Health Collaboration Program, or JMHCP, and the Bureau of Justice Assistance. After that, there will be a brief overview on the Institute of Intergovernmental Research, and then we will get into the presentation. Finally, toward the end of the webinar, we'll have time for questions and answers. Anytime during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues that may not be able to resolve. We are recording the webinar and will post it on our website by the end of the week. Joe McHow, Senior Manager, Institute for Intergovernmental Research. In his capacity, he serves as the Principal Law Enforcement Advisor to the Criminal Justice Initiative team. His responsibilities include strategic planning, training, and technical assistance, development and delivery, and field-centric research and planning. Mr. McHowell retired from the Kansas City, Missouri Police Department, KCPD, in 2016 at the rank of major. While serving with the KCPD, he designed and managed the largest collaborative violence reduction effort in the KCPD's history. As the project manager for the Kansas City No Violence Alliance and the commander of the Violent Crime Enforcement Division, Mr. McHowell implemented a multifaceted approach to violent crime reduction that incorporated service delivery, community engagement, and robust prosecution through strategic prosecutorial partnerships. Mr. McHowell designed and managed Kansas City pilot-focused deterrence program. Mr. McHowell also commanded the KCPD's largest patrol division and supervised one of the KCPD's technical response teams, SWAT, and the Street Narcotics Unit undercover section. In addition, he was the operations supervisor for the U.S. Drug Enforcement Administration-led Midwest High-Intensity Drug Trafficking Area Investigation Support Center. Mr. McHowell holds a bachelor's degree in administration of criminal justice from Grantham University. Again, I am Demetrius Thomas, the Deputy Program Director in the Behavioral Health Division of the Council of State Governments Justice Center. As the Deputy Program Director, I oversee the Justice and Mental Health Collaboration Program, training and technical assistant grantees. Prior to joining the Justice Center, I worked at the New York City Department of Health and Mental Hygiene, where I led the agency's work at the intersection of criminal justice and mental and behavioral health, including establishing the city's first ever diversion centers, co-response, and mobile crisis teams. Next page. Next, we'll provide overviews on the mission of the Council of State Governments Justice Center, the Justice and Mental Health Collaboration Program, and the Bureau of Justice Assistance. BJA's mission is to help to make communities safer by strengthening the nation's criminal justice system. Its grants, training, and technical assistance and policy development services provide state, local, and indigenous nations with cutting-edge tools and best practices that they need to reduce violence and drug-related crime, support law enforcement, and combat victimization. Next slide. I'm going to give some feedback on the Council of State Governments Justice Center. The Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials and all three branches of government, with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Our goals are to break the cycle of incarceration, improve health and opportunity and equity, and expand what works to improve safety. As described earlier, today's webinar is a part of the Justice and Mental Health Collaboration Program, JMHCP, Training and Technical Assistance, TTA, which many of you may already be familiar with if you currently have or had a JMHCP TTA grant. The JMHCP TTA promotes innovative cross-system collaboration and provides grants directly to states, local government, and federally recognized indigenous nations to improve responses for people with mental illness and or substance use disorders who are involved in the criminal justice system. Again, thanks everyone I'll be back later in the webinar. Now I'm going to turn it over to Mr. McHowell, who, as moderator, will provide us with an overview on the Institute for Intergovernmental Research, again, IIR, and lead us through today's presentation.
Thank you, Demetrius. Next slide, please. As Demetrius related, my name is Joe McHale. I'm a senior manager with the Institute for Intergovernmental Research. IIR is a private nonprofit corporation specializing in criminal justice and homeland security issues. We provide expertise in program development and implementation, management and operations, data collection and analysis training, and TTA. Some of the programs we support on behalf of DOJ include the Comprehensive Opioid Stimulants and Substance Abuse Program, the Valor Program, and the National Public Safety Partnership. Next slide. Next slide, please. We have 4 additional presenters today who will be sharing their expertise as it relates to building and maintaining partnerships. Diane Reagans is a senior research associate with the Institute for Intergovernmental Research, where she supports the United States Department of Justice's National Public Safety Partnership and the Office of Community-Oriented Policing Services Implementing Change Program. Diane previously managed IIR's information sharing projects, including the Global Justice Information Sharing Initiative, the Criminal Intelligence Coordinating Council, and the National Network of Fusion Centers and the Building Communities of Trust project. After Diane, you will hear from Chief Chris Skinner of the Eugene, Oregon Police Department. Prior to this position, Chief Skinner served as Richland, Washington's Chief of Police, and also served with the Hillsborough Police Department, where he held the positions of Lieutenant Commander and Deputy Chief. While with Hillsborough, he had the opportunity to work with diverse populations and initiated a domestic violence response team to better serve victims of domestic violence in his community. Next will be Ms. Caroline Huffaker. Caroline serves as the Victim Services and Chaplains Director for the Chattanooga, Tennessee Police Department. In 2016, Ms. Huffaker was hired by the Chattanooga Police Department and tasked with building its first co-located victim services unit for the department. Ms. Huffaker regularly trains both sworn personnel and professional staff on victim-centered, survival-led approaches in advocacy, as well as trauma-informed policing and care. Rounding out our presenters today is Dr. Ken Novak. Dr. Novak is a professor of criminal justice and criminology at the University of Missouri, Kansas City. He received his PhD from the University of Cincinnati in 1999. His scholarship has focused on issues relating to policing in America, with a particular focus on officer decision-making, racial profiling, and police-initiated crime prevention strategies. Dr. Novak's work is routinely published in peer-reviewed scientific research journals, and he is the co-author of Police and Society. He was the co-research partner for the Kansas City No Violence Alliance between 2013 and 2017. During today's presentation, any of the attendees have questions or concerns, as Demetrius related, please place them in the Q&A feature shown at the bottom right-hand section of your screen. Next slide, please. Today's presentation is going to focus on developing and fostering partnerships. Over the last 30 years, we have all witnessed so many progressive changes occurring in the law enforcement profession: body-worn cameras, high-performing personal equipment, reporting, tactics, and technology. While at the same time, I think we can safely say that we also saw it continue to be siloed and inwardly facing at times, and not designed to take advantage of what true partnerships the community can bring to bear to achieve the goals and objectives to keep our communities safe. Today, our panelists will discuss their experience in developing partnerships and relate the successes and challenges that they faced. Next slide. I don't want to cue the obligatory eye roll when I quote Sir Robert Peel, who is the father of modern policing, but his words ring true to this very day. One of Peel's most famous quotes is, "The police are the people, and the people are the police." Peel is relating to the bullet points that you are seeing on this slide. When police agencies integrate themselves into the civic functions, neighborhood groups, and myriad of services in their community, it truly builds community trust, improved relationships, and communication. It also provides the transparency and feedback loop with the communities we serve to enhance our legitimacy and support from the public. I'd like to relate the quote on your screen from the QOP's office. "Effective partnerships between law enforcement and the community stakeholders are essential to public safety, and it is most important that government agencies, community groups, nonprofits, businesses, and private citizens All embrace public safety as a shared responsibility. Next slide. Partnerships are only as good as the outcomes. Partnerships must have four things. They must have focus, a sense of urgency, common goals, and they must be nurtured and constantly refined. Finding the right partners that reflect both the needs of the agency and that support the strategy must also be married to the multicultural needs of the community. Community partnerships are certainly a key to a healthy and safe community, but there are many factors that you must consider. For example, I witnessed firsthand service agencies and community-based entities that wanted to partner in various ways that were of significant benefit. Conversely, I also had to have difficult conversations about partnerships when the agency that wished to partner did not match the needs of public safety or were pressing programs that were not vetted, properly governed, or funded. Next slide. There are so many different examples of partnerships as it relates to building safer communities. Some of those examples are well established, such as citizen advisory boards, and others that are relatively new to the criminal justice arena. As many of you know, there's a significant gap in collaboration that law enforcement has with mental health service providers and dealing with such issues such as homelessness that has been relegated to law enforcement, which obviously does not solve the issue for the homeless individual or the community. There are exceptions to this. In just a few moments, you will hear from the Chief of Police in Gresham, Oregon, about their collaborative CAHOOTS model. This model of mental health and crisis intervention collaboration has been in place for many, many years and has shown significant success. Next slide. The why, as it relates to partnering, should be obvious. But remember, partnering without a common goal and a sense of urgency will not be effective or worth your time. The first question you must ask is, what value do I bring to the partnership? And what value do I expect of my partners? It has to be a two-way street. Finally, building partnerships is hard, but sustaining these partnerships is even harder. You'll need to meet regularly, adjust expectations, and build MOUs and communication loops to keep the partnership productive, even when key people in the partnerships leave, get transferred, or retire. I will now turn to IAR Senior Reach Associate Diane Reagans, who will provide some context on how to develop and foster relationships. Diane?
Thank you, Joe, and good afternoon, everyone. It's my pleasure to be able to be here with you today and share a few lessons learned from my own experiences and from supporting organizations and agencies working to build collaborative partnerships. You may be asking yourself, how do I actually do this? I'll be touching on several core components with building and sustaining partnerships over the next few minutes. Trust is a foundational element when collaborating and partnering. Other important elements include identifying stakeholders to partner with, including individuals or organizations that have appropriate expertise in the topic area or areas being addressed. You should identify a vision, goals, a strategy, and an action plan among the partners you bring together. Be open-minded and willing to listen and learn. The old adage, you don't know what you don't know, is so very true. Communicating openly and routinely are vital. First, you must identify the community's needs and issues. Be proactive and identify various groups, organizations, and participants that you'd like to include. These could be representatives from neighborhood associations, student groups, which is especially important if you have a college or university nearby, advocacy groups, and service providers such as homeless shelters and crisis intervention and counseling services. I recommend using multiple methods to reach out to the groups and obtain input, such as listening sessions, town halls, surveys, online forums, or call-in lines. At the same time, identify ways that you can educate the community on the priorities and role of your agency. For instance, use handouts at the listening sessions, leverage your agency website, attend other community and service organization meetings, and do interactive presentations involving Q&A with the audience. When coordinating listening sessions or town halls, be mindful to have meetings in a neutral location, one that is accessible to the attendees, where they feel non-threatened and more comfortable to speak up. Listen to the issues and challenges identified. They may be obvious, or you may be surprised with what you hear. What is the community concerned with? Youth-based crime, substance use disorders, domestic violence, car speeding in their neighborhood. Moving to the next slide. After you've compiled the results and heard what the community needs and challenges are, it's important to prioritize what you're going to work on and strategize about what type of response is needed to address the issue. You heard Joe speak about this before. Is a coordinated response needed to address a spike in crime, a quality of life issue such as noise complaints or garbage in the street, or a social issue like homelessness? After you've assessed what you've learned and prioritized the issues, take time to think about the ways you can address the need. This will be helpful when determining what types of partnerships would be best suited to address the issue or the needs identified. Some examples include the co-responder model, the domestic violence team, youth-based community teams, or a victim services team to support domestic violence or sexual assault victims. You'll be hearing from several speakers today that will provide more detailed information about their experiences with partnership-based programs similar to those I just described. Moving to the next slide. So if you've categorized and prioritized the issues, determine what partner opportunities are available, and you're progressing towards bringing the proposed team together. In addition to having multidisciplinary collaborators, such as social service providers, school district officials, and local government agencies, strive for diversity among the partners represented. That means multiracial and multicultural. If you have an advisory or governance board, you should consider including faith-based leaders, business leaders, previously incarcerated people, law enforcement, community members, and also representative from the protest community. As we move to the new slide, now that you've identified the proposed partners, if you don't already have a relationship with them, reach out and initiate a conversation or meeting. The individual responsible for leading your team's engagement in the partnership should be high-ranking with appropriate decision-making authority. Select individuals that truly believe in the process, have empathy, and want to be involved. That person should be motivated and a self-starter. Motivators keep partners interested and support continued involvement. It's important to do your homework. Learn as much as possible about the culture and environment of the partners. I ask you to recall the fundamental element of trust that I spoke about before. Developing trust is complex. It requires an open mind, a willingness to listen and consider another person's perspective. Without trust, there will be hesitancy to work together as a team. Together, the team should develop a strategic framework and an action plan, decide what to do about the issue, and identify the action plan and tasks to accomplish the mission and goals. A shared vision will help bring focus to the team, and an action plan is necessary to guide the partnership. Working together, the group should identify the roles and responsibilities for each multidisciplinary partner and formalize the partnership with an MOU or a contract. Next slide. Accountability is an assurance that an individual or an organization will be evaluated on their performance or behavior related to something for which they are responsible. In addition to the individual partner organization's policies and procedures, together the partners should develop accountability measures. The action plan mentioned previously can serve as an accountability mechanism for the partnership. One goal of partnerships is to achieve free-flowing, two-way communication among members of the team. Much can be accomplished when partners feel like they have a voice, and the team members engage in joint decision-making and share responsibility for the common goal. Support and foster the relationships and partnership by creating programs as a team and organize joint events and activities, such as hosting a sports event for youths or the like. Next slide. Any communication about programs, joint activities, outcomes, etc., should be coordinated. I recommend that the process, protocols, and responsibilities for communication related to the partnership be outlined in the MOU. Communication should be timely, transparent, and easily accessible to the public. Utilize both traditional and social media, partner websites, create newsletters, and leverage other organizations' publications. Publicize and celebrate your successes and milestones. Consider having people that benefited from the partnership program speak about it. It's very impactful when you hear someone talk about their actual experience and how they recovered. Identify a research partner, a college or university, to assist in collecting metrics and evaluating your partnership program goals. Dr. Ken Novak will delve into this topic more later in the presentation. As we move to the next slide, I'd like to stress the importance of creating mechanisms to support continued engagement of the partners. community buy-in, and sustainment of the program. In order to support continuous learning and improvement, metrics and mechanisms should be developed to measure trust at the community level. This helps ensure that local needs are being met and responded to. Building trust requires two-way communications and routine reassessment of local opinions and needs. Continuous engagement with communities and providing feedback to community members on the results of the suggestions that they have made shows a commitment to their short and long-term needs. I recommend that you periodically assess the makeup of the partner team to ensure it reflects the diversity of the community that you're serving. Before turning this over to Chief Skinner, I'd like to stress the importance of prioritizing your partnership through action. I think we all have heard and know this, that actions speak louder than words. Thank you. Chief Skinner?
Well, thank you so much for tossing that to me, and good morning to everybody, or good afternoon to everybody, depending on where you're at. And it is just an absolute honor and pleasure to be here with you and spend a little bit of time today to talk a little bit about some things going on in Eugene, Oregon, around dealing with mentally ill and homelessness and filling the gap that we've had in Eugene over the past few decades. So I do believe that I have a slide. So the next slide that would help this. And we're going to be talking about cahoots. Now, some of you may have heard about cahoots. We've been talking a lot about it over this last year. Crisis assistance helping out on the streets is the acronym that makes up cahoots. And it was founded 31 years ago, almost 32 years ago. And before I get into the details of cahoots, and I've done this a lot, and so I'm going to try and hit some different points about the cahoots program that people have really been interested in, everything from why it exists all the way through implementation to kind of the challenges with this model and really the successes with this model. Let me just orient you a little bit about Eugene, Oregon. Eugene, Oregon is in obviously central western part of Oregon. It's about 50 miles from the coast and about 50 or 60 miles from the Cascade Mountains into central Oregon. It's the home of the Oregon Ducks. So it's a university town. It's about 180,000 people and it's about 50 square miles big. So it's a mid-sized town in Oregon compared to many. But what's interesting about Eugene is that our point in time count for unhoused adults is about 2,500 for a city of that size. It's arguably one of the highest per capita counts for unhoused, maybe in the nation, if not the West Coast. And so we've really had some challenges around unsheltered adults and behavioral health issues, mental health, substance addiction with our unhoused population. And so years ago, back in 1989, as this problem started to reveal itself, there was a gap in services. Now, we all see this gap in services across the nation. And what's unfortunate is oftentimes we fill that gap with our public safety personnel. But we saw this gap in services, and we had a local nonprofit by the name of Whitebird staff a vehicle with a crisis worker and somebody that had some basic medical knowledge to go out and start trying to meet the needs of these individuals that didn't neatly fit into kind of a response model for the police department. And quite frankly, often found police in conflict with these individuals when they were in crisis, and started filling that gap of how do we respond to these individuals when they're in crisis? How do we respond to these people that are in a behavioral health crisis or setting, and do it in a way that has a tendency to de-escalate or to bring wellness to the person, as opposed to trying to get our police officers to learn how to do all of these things. And so we've grown into our shoes, so to speak, when it comes to the cahoots model here 31 years later, talking about them filling that gap. That relationship is unique in the sense that many organizations are building this crisis response or this alternative response within their own organization or within the government structure. And this one's unique in the sense that it's a separate social service provider that we contract with. So we have kind of an arm's length relationship with them. And so that's different. It's different in a good way, in the sense that they have their own unique kind of brand experience. They're well known in our community. They're not seen as an extension of government. They're not seen as an enforcement arm of law enforcement, and so it has a tendency to immediately de-escalate a situation, and has fostered trust with those people that are in crisis. And in some ways, it's been a challenge because, like most social service providers, they constantly have turnover. They constantly struggle to recruit and to be able to pay their employees enough to be able to create career employees out of them, instead of just people that are stopping over for 6 months, a year, 2 years at a time. And so we see a tremendous amount of turnover when it comes to this. And so with that relationship is difficult. It's hard to continue to build that if we're seeing new faces every 6 months to a year. And so there's some challenges around that. But overall, the Cahoots model is seen as a value add in our community, and like I said, is well known and well branded within our community. How Cahoots works for us is the city of Eugene contracts with Whitebird Clinic, which houses the Cahoots program. We contract for them for a certain number of hours per day of service. So we have one van that's 24 hours, and then a separate van that's 7 hours on some overlap. And then we've just recently added 5 more hours of service. The city provides the vans, the city provides the maintenance and the gas on the vans, and the operating expense of the vans. We provide the MDTs, or the mobile data terminals, in their vans, so that they can manage their call load. And we contract with them. They staff those vans with a crisis worker and a EMT paramedic of some level, so that they can provide some level of medical support when needed out in the field. And so all of those calls that we get from our community around behavioral health issues will be funneled through our 911 dispatch center. Now, that's a little bit different. A lot of people have challenged and wondered, should there be a separate number for them? Should this be going through a different resource than your 911 call center? And what I have often told people is, there are no better equipped people than your 911 call takers to ask the right questions to match the resource with the need. They do that every single day. They state certified. They are really, really skilled at asking questions and drilling down and trying to get the sense of what's going on out in the situation to be able to match that right resource with the need. And so what we see is our call takers doing a really good job of asking those questions. And when somebody calls our call taking or our dispatch center, what the caller hears is police, fire, and Cahoots as an option. And so we publicize that is an option for a response in our 911 center. And that really has helped people to understand that there's something out there other than a police or fire response for what they're seeing out there. And so as the call taker gathers that information, and as they decide what's the right response for the need, is it a medical response? Should this really be fire and EMS, or is it too dangerous for Cahoots, and should it really be a police response initially, and then maybe a warm handoff to Cahoots, or in fact, does it fit neatly in that bucket for a Cahoots response? That call taker does a fantastic job of doing that. The other thing that's really interesting about having it go through our 911 center is it almost immediately deconflicts anything that may be going on with respect to a dual response. So for instance, if somebody had a separate number to call for Cahoots and they were convinced that they were seeing something out in the field that was a Cahoots response and called Cahoots directly, we could concurrently be having somebody call non-emergency 911 or even 911 who sees things from a completely different perspective. And now we have a police response and a Cahoots response happening simultaneously, going to the same location. And you can see how that could be conflicting, and how we certainly want, for safety reasons and other reasons, we want to make sure we deconflict. And so there's an opportunity to deconflict when it comes through a central public safety answering point. We can triage those calls, and then we can dispatch those calls. Now, remember, you heard me talk about Cahoots vans having an MDT, and that's an important piece because that's where those calls show up for those Cahoots workers is on the MDT. We ask them to manage their own calls, so they will have a queue of calls or a call list that they have to go through. And part of our service level agreement is, of course, we can preempt some of that and bump some of those calls to the top of their list if we're seeing something that maybe they're not exposed to around the importance or the severity of the call that needs to be elevated above other calls for them to respond to. So that's very much a collaborative effort when we do those types of things. Oftentimes I'm asked about the relationship between the social service provider and EPD, and like I mentioned earlier, it's very much a arm's length relationship, outwardly facing, and behind the scenes, it's very collaborative. We're constantly in contact with them. We constantly take a look at how we can deliver the service better, how we can support each other, where we have conflict or where Cahoots believes a call that, there was a call that maybe they should have gone on that EPD went on, or vice versa. We work out those issues, and we really have a very strong operating agreement or service level contract to help spell out what it is we expect from them and how we're going to communicate. And I think that that's really, really important to be able to do that. The types of calls that Cahoots goes on, as you can imagine, they respond to about 23,000 calls for service a year. And that sounds like a big number, especially for an agency our size. But what I would say is they only divert about 6 or 8% of those calls away from EPD, largely because the Eugene Police Department is so busy that those police officers are going from call to call to call. And so many of the Cahoots calls that the Cahoots workers would go on, the Eugene Police would not be going to anyway. And so we can't say that they divert all of those calls away from us if we're not going to be responding to them anyway. And so, there you can imagine what a huge gap there is if that were to exist. About 6 to 8% of those calls they divert for us, and a large number of the calls that Cahoots responds to are things like transports. People that are in crisis that need to get from point A to point B, whether they're missing a medical appointment or maybe an appointment with their probation officer or a court date. Just providing simple transports has a tendency to de-escalate a person that's feeling overwhelmed or a high level of anxiety or experiencing a behavioral health issue. The other thing they respond to is well checks. Our fire department and police department do not respond to well checks. For instance, we see an individual laying on the concrete that hasn't moved for a while. We don't know if they're sleeping or not. Those are responded to by Cahoots because most of the time, those are people that need that type of resource. They're not necessarily in a medical crisis, and they certainly aren't in a law enforcement crisis, but they may be in a behavioral health crisis. And so we want to make sure we're sending behavioral health first responders to behavioral health issues. And so they'll go to those well checks. And so a big part of those 23,000 calls for service are transports, well checks, and other lower acuity calls that the system otherwise would not be able to respond to. I spoke about the gap. If they weren't here, think about that much need in the community without any kind of a resource, and think about your own communities and what resource you're putting towards that. And really, when we think about this last year for law enforcement, and as a chief of police, I've thought about this a lot over this last 18 months, and even prior to that, is how do we match the right response with the need? And I really think the cornerstone of police reform is around how we get our police officers redirected to doing what police officers should be doing, and actually build a system that has a response for the other needs that have a tendency to immediately de-escalate an already challenging situation. And so we're really pleased with what Cahoots has been able to do. We believe that it is a key piece of ongoing police reform and the ability for us to be more focused on what police officers should be doing. And lastly, I'll just finish kind of anecdotally with another piece of this that often is forgotten, but it certainly is not for me, is the ability of filling that gap with this type of need as a crime prevention tool. If you think about an individual that's on the streets, that's struggling, that might be in crisis, whether that's substance induced or mental illness, they're in a behavioral health crisis. We get calls about those types of individuals every single day, all day. And if left unattended, what's the opportunity or the possibility that those folks continue to escalate further and further out of control to a point where it becomes a police issue, to the point where it becomes dangerous or combative or violent and police have to intervene? And that's not what we want to have happen. The fact that we have a behavioral health model that can respond to those individuals and almost immediately de-escalate those things, I believe is a crime prevention tool, or at the very least, it's a call prevention tool where we're not having to have a call for service for our law enforcement professionals to be able to go to. Cahoots workers arrive on scene, very unassuming, dressed appropriately to almost immediately de-escalate. They are well trusted and well branded, and I think the people that are struggling, obviously don't see them as a threat. We as law enforcement professionals arrive on scene and we're in uniforms and we have badges and we have guns and we have cars that scream law enforcement, or even your best attempt at building something internally to soften the look or soften the uniform for your law enforcement professionals, that those folks that are in that crisis still know that there's an enforcement component or potential for an enforcement component. And the last thing we need those folks to be thinking about is having to go to jail in that moment, that we need them to be able to bring themselves under control or get to a place of wellness. And so Cahoots workers for us do that. And we're so pleased that we have them in our community, and so pleased that Eugene Police Department can be their partners in everything that we're doing. I will look forward to any questions that I can answer. It's a lot of information, and oftentimes some of the questions are more operational about how do you do this and how do you do this, and kind of what's the good and the bad of everything going on. I'm happy to answer those at the end of this particular webinar if you have those for me. At this point, I'm going to turn it over to Caroline, and you're going to hear about some wonderful work that's happening in Chattanooga, Tennessee.
Thank you so much, Chief Skinner. I'm very excited to have the opportunity to have been invited to participate today and share with you all what we are doing in Chattanooga, Tennessee. So in 2016, I was hired by the department through a grant called Enhancing Law Enforcement's Response to Victims, or ELRV is what we affectionately call it. And that was a grant that essentially started our very first co-located victim services unit within the Chattanooga Police Department. And so when that began, we had some pretty stringent grant requirements through ELRV, not just that it was used to start a unit, but we had been given our marching orders to essentially have a top-down, bottom-up approach to creating a victim-centered organization. Part of that obviously was implementing a direct service component of victim services, but we also looked at training, curriculums, policy and procedural development, and just overall organizational structure with a victim-centered philosophy in mind. And so since we began in 2016, we grew from a unit of 1 to now having 6 full-time professional staff members, along with a master's level internship program where we take on a few students who are working towards a master's degree in one of the helping professions to help us in providing comprehensive advocacy and case management services to victims and survivors of crime. And so I think one of the things that we discovered at the time was that we were essentially creating internal partnerships at CPD, and we were creating really strong and strategic professional relationships between our full-time staff and the officers. And one of the benefits of that was that we were co-located. So having previously worked out in the community as a victim advocate, I had a community-based advocacy experience, which I think I enjoyed really great working relationships with our officers. But it wasn't until I became a Chattanooga Police Department employee that we saw kind of our foot on the gas, so to speak, in terms of building relational capital with the officers, because we were a known entity to them. They know us. We also follow the same policy and procedures and professional standards that the officers do. And so we're all held to this same level of accountability and expectation, being that we are all employees of the police department. And so that really kind of centered our work on core values, and really gave us a united mission in what we were looking to do with implementing victim services. And so, as I mentioned, we definitely looked towards creating direct services, but we wanted to be really strategic in how we incorporated victim-centered philosophies into the overall organizational structure, which includes policy development. And so myself and some of our staff actually sit on our policy review committee and look at all of the different touch points that a victim might have engagement with the Chattanooga Police Department, not just, our what we call Admin 33, which is our victim services policy, but what does property division have in there around victim engagement? Do they have anything around property return to victims and survivors of crime, any procedural development that could happen there? And those are some of the lessons that we learned by having our staff actually sit on our policy review committees alongside our officers to make sure that we were considering a more holistic perspective in terms of victim engagement and experience from the policy level. We also were really strategic in making sure that our training curriculums were victim-centered, and making sure that our staff, myself included, train at every level of the department. And so we are in service every year. We are in roll calls, trainings, lineups. We are at the cadet level, so essentially starting them off on this stronghold of a victim-centered service when they're already in the academy. And then, of course, I do trainings with our command staff and executive staff on specialized topics, or for investigative units if there's one particular area that they're wanting additional support in. And then when it came to operational planning, we looked at different ways that we could essentially institutionalize victim services into the fabric of the department. And one of the ways that we did that was through our promotional process. As you all probably know, or if you don't know, there's a pretty significant promotional process that officers can go to when they're looking to promote to different ranks. And what better way to create the next leadership, police leadership, generation in your agency than actually testing them on the philosophies and the procedures that incorporate victim services. So absolutely, it's important to test your folks on use of force, policies and procedures, and making sure it's applied appropriately. But so too do we want to test them on their knowledge of victim-centered policing and victim-centered direct service provision, and what their role is in that process. And so what that does is also teaches your agency that your executive staff values victim services so much that they're willing to put it on your promotions testing, because the expectation is that you are to uphold that. And so we were trying to be so strategic that if anyone ever came into the agency and wanted to perhaps change the direction or the trajectory of our department into maybe not having as much of an emphasis on victim services, we've put it in so many different places in our police operations and in our agency's operations that it would become glaringly obvious if someone tried to dismantle victim services or change the trajectory of being victim-centered in our response. And so I think that that's been really helpful. We're certainly about to have that theory tested as we're about to get ready to go through another administration change. So we've gone through 2 administration changes in my time at CPD. And so, we've always said that we wanted to create systems that existed beyond our presence at the police department whenever someone moves on. And so that's certainly going to be a challenge. Under there, you see that change is the only constant. And so that's why, again, trying to institutionalize these practices can help further your reach internally in your partnerships, because you have, again, raised that next generation of police leaders. Another challenge that we did have was buy-in. Sometimes it's too much and sometimes it was not enough. What I did find was that once our officers understood the value of what we do and how we contribute to the response of the Chattanooga Police Department, they began to almost overpromise what we could do, and inevitably we would underdeliver because maybe they didn't fully understand, or perhaps we could have provided them with greater role clarification of what we could do and could not do. And so sometimes you can experience mission creep when you're implementing victim services. Now, anything that has to deal with victim services and support, it automatically is told, you know, that's victim services job. What we wanted to make sure didn't happen was that our officers, just because we had a victim service unit now, we didn't want them to fall into the trap of abdicating their responsibility in providing a victim services centered response. So just like it's my unit's role to uphold all of the policies and procedures of the Chattanooga Police Department, we wanted to make sure our officers understood that they're still responsible for responding to victims and survivors in a trauma-informed way. And so we had to be really careful to make sure that there wasn't so much buy-in that they were relying on us too much, that they weren't practicing the very skills that we were teaching them through training and policy and procedure development. And like a lot of things, when you're changing something organizationally, whether you have an organization of 15 or 500, it takes time. And a lot of times folks will throw in the towel when they don't see change happening as quickly as they would hope. I would say probably by about year 3 of implementation of victim services in our department, I felt like we began to kind of hit our stride. And I would say it probably took every bit of 3 years. There were certainly some successes along the way, but it can definitely take time. And so what I would encourage folks is that if you're looking to implement any type of internal or external partnership, is that just knowing that if it's difficult, or if it doesn't seem as though change is happening quickly enough, that doesn't necessarily mean it's not worth pursuing any longer. It just means you might need to hang on for a little bit longer in order to see essentially the payoff of that investment. And then shifting into external partnerships, we have been looking for ways to move beyond what we found to be our traditional partners in the community. And so it's really great to partner with your domestic violence shelters and your children's advocacy centers and sexual assault programs. And those are good and valuable resources, and they're necessary clearly in order for us to do our job effectively in serving victims. But we looked to explore other areas of partnerships that might support the work and the overall mission and goals of what we were looking to accomplish at Chattanooga Police Department. And so as part of our original ELRF grant, one of the things that we had been doing were running focus groups internally with our officers to measure their attitudes and beliefs and perceptions about victim services, trauma fatigue and compassion fatigue. How burned out were they feeling, essentially? Because we know that in our field in victim services, it's kind of the old adage that, you need to engage in self-care so that you can continue to be healthy for others. And so introducing that concept to our officers of making sure that they are the healthiest version of themselves so that they can be the healthiest version for their external community. And so we were looking for ways to support them as individuals and develop them in ways that were meaningful. And so we partnered with our public library to create a book list of titles that they can recommend to one another, whether it be a topic specific to their profession within law enforcement or leadership development. And so they were able to participate in this book exchange, but it was with an external partner through our public library, and it supported their work as well. And it was this really unique opportunity, and we call it the Blue List. And the officers actually designed a logo for themselves, and it's been a really interesting experiment. And we found that even entire patrol teams have gone through a book study together at the request of their sergeant, and pulled out themes and had really helpful discussions, even in the 15 minutes that they're checking in during roll call with their sergeant. And so it's just trying to find different ways to support community partners, engage in non-traditional means. And that's been really exciting for us to do things in that vein. Another piece of what we found with our external partnerships is that just that we are a softer connection or tie-in point for the criminal justice system. I think that there are some really great, I know there are really great officers out there doing really great work. And at the end of the day, it can still be a barrier based on the fact that they have power and authority over a lot of factors when it comes to engaging with victims and suspects for that matter. And so I think having someone in the victim services profession being essentially the access point for the criminal justice system sometimes lands a little bit better. What I have found is our officers sometimes will come to us and say, I have explained everything to the best of my ability to this victim or survivor, and they could be communicating the very same information, but when someone from our unit is the messenger, essentially, it's landed and processed differently simply because we're not law enforcement. And so I've also seen it work on the flip side. There have been times where I've been trying to communicate something, whether I'm out on a scene or in perhaps a high stakes situation with our investigators or our officers, and my lack of command presence or perceived power and authority over a situation has not served me to the best of my ability, and I've had to call upon my sworn counterparts to help me in delivering a specific message. And so, there's certainly a transitive property to that. It can go both ways, and so that's been really helpful, again, for the internal partnerships. But for external partners, we find that community members themselves or agencies feel more comfortable coming to us first for information, referrals, and perhaps guidance on what to do in a situation than they would coming to an investigator, no matter how great that investigator has been in their interactions with that individual. However, some of the challenges with this have been history. I think we can all recognize that history is powerful, both at the agency level and individual level. And so it could be that an individual has had difficult relationships with the Chattanooga Police Department in the past, and they are not aware of the work that we've done to improve ourselves as an organization. And so what kind of reconciliation work needs to happen? We've had conversations with folks where we have said, I can recognize that that was your experience in the past, and it might take time for you to trust us again. I think that takes a certain amount of humility for us as service providers, even if we were not the one that caused harm, but the simple recognition of it has a really leveling effect and can level set a relationship with someone where there might be some strain. But recognizing that that history is there, whether it's with our agency or just the public safety community as a whole, it's really important when it comes to building that relational capital. Kind of in that same topic area is just the current climate. There's a lot going on in the discussions nationally and even locally in our agency around public safety and reimagining public safety and what that could look like, not just the enforcement piece, but the proactive and preventative piece as well. Similar to what Chief Skinner just shared, that's a fantastic view on public safety that they have there in Eugene around what does public safety look like from all facets of community services, law enforcement being one of them, mental health being another. And so I think that's where we're going to have to kind of dig in a little bit in the current climate, even though our tendency might be to backpedal out of it, because those can be some difficult conversations. But very much to the history piece, there's some reconciliation work that could and should be done there. And the exercise of just having those conversations, like I said, can really level set a lot that's happened in the past. And then naturally, there are time and capacity issues. A lot of folks want to partner with law enforcement, despite some of the narratives that may be pushed out there. We're still having a lot of folks wanting to engage with us. And so we have to be thoughtful about what does this partnership look like? Can we contribute in ways that feel meaningful and valuable to folks, in ways that will serve the partnership as a whole, And so we also want to make sure, again, that we don't have mission creep, that we're not wrapping ourselves up just because someone is knocking at our door to engage in a partnership. Are we the most strategic fit? Sometimes we may not be as a police department. Sometimes it might be someone else. But we really, I think the tendency is let's take on more, let's do more, because that makes us more communally and missionally focused. And sometimes that may not be the case. And so drawing some good, healthy boundaries and parameters around what that partnership is, do we have the bandwidth for it, and who's the most appropriate fit, have been some of the challenges that we've experienced in our time at Chattanooga Police Department. And with that, like Chief Skinner said, I will welcome any feedback or questions that folks might have, but I will go ahead and pass it over to Dr. Ken Novak to share about his work in this field.
Thank you, Caroline. With the time that I have been allowed, I want to talk about researchers as partners in public safety efforts. The concept is not necessarily new. However, integration of researchers in strategic crime prevention and public safety strategies has been sporadic. Much of this may be due to the misunderstandings across police, prosecutors, and researchers on how researchers can add value to efforts. I'll borrow heavily from the concept of action research. The action research model was the foundation for the original Project Safe Neighborhoods grant program. And action research is a particular approach to the research process in which researchers engage in an active partnership with practitioners or operational agencies to solve problems and evaluate strategies. This is different from the traditional approach where researchers may be viewed as third-party auditors who try to determine whether a program, quote unquote, worked or achieved its goals. Often researchers would swoop in at the end of a program or even after a program is concluded to determine whether it worked. Action research is not follow that strategy. So how do researchers add value to public safety efforts, and what are their roles? I would argue there's 5. First, researchers can contribute to the problem identification process. Suppose you think about the scanning and analysis phases of problem-oriented policing. In that case, researchers are in a good position to assist agencies in analyzing their own data or pulling data from different sources like hospitals or public health data, and to provide a new lens to understand the nature, extent, and sources of underlying crime problems. Second, researchers are involved with developing an intervention or response. Researchers provide perspectives on different strategies available to achieve the group's goals. This is strategic problem solving. Researchers are in a good position to translate evidence-based practices into its local context and help establish performance metrics while providing a perspective on what has worked, what didn't, and what's promising in other jurisdictions. Researchers also have access to a network of other researchers for training and technical assistance, which can be very helpful during the formative stages of these initiatives. Third, action researchers are involved in the implementation of the strategies. Now, they're rarely involved with actual operations, but are in a good position to help coordinate resources from across a variety of different partners. Historically, the criminal justice system has operated in a linear fashion, where the police, prosecutors, and corrections operate pretty independently of each other. In the past several decades, interagency partnerships have been seen as a solution to implement a comprehensive strategic response to crime. Researchers are in a unique position to help coordinate this communication as well as resources across partners. Fourth, action researchers monitor implementation for fidelity. That's just a fancy way of saying, in plain English, was the plan fully executed? This is especially important for evidence-based practices that can have a lot of moving parts across a lot of different partners. As insiders, researchers can track the implementation and provide a process evaluation to ensure that evidence-based practice is being implemented as it was designed. Finally, action researchers are engaged in the assessment or outcome evaluations. In other words, did the strategy achieve its goals? This can be done both qualitatively or quantitatively, and researchers have developed a skill set consistent with this task. Historically, this is the step where researchers would get involved, but that approach is pretty limiting because if researchers were not involved or did not observe how goals were created, what metrics were being used over time, whether those metrics changed over time, or how data were collected, and whether the strategy was implemented with fidelity, then their ability to determine whether something worked is very limited. So crime prevention in the 21st century has become much more collaborative, where agencies such as police, prosecutors, probation, mental health providers, neighborhood groups, and the faith-based community have increasingly partnered to pool resources to prevent crime and to promote public safety. Action research partners can be a valuable ally in this effort. And I too would enjoy having a conversation, answering any questions. But with that, I'm going to turn it over to Joe.
Thank you so much, Ken. We'll go to the next slide. And I had the distinct pleasure of working with Dr. Novak in Kansas City, Missouri, where I was the project manager for the Kansas City No Violence Alliance beginning in 2012. My job was to build, from the ground up, a violence intervention effort that integrated specific messaging, service delivery, and enforcement to the groups and gangs in Kansas City that were involved in a significant amount of violent crime. At the time, Kansas City had historically remained one of the top cities in the United States for violent crime per capita and had not seen less than 100 homicides for decades, literally. Well, I could speak on the progression of the Kansas City No Violence Alliance for hours on end. I want to specifically highlight some of the core partners that contributed to the effort and how their contributions allowed the program to see some limited success. One thing I have found is that the domino effect can occur when you are partnering effectively and that it'll lead to more partners. Just a quick story. In 2012, just as being assigned to the Kansas City Nova project, I was at a crime scene and I was introduced to Miss Rosalind Temple. Miss Temple was at the crime scene and we began to chat about her history and why she was at the crime scene. Miss Temple related that she had lost her son Pee-wee to a homicide and she was struggling to find a new purpose in her life. She related to me her struggles with addiction and that she had spent time in prison. She related that she wanted to make a difference in Kansas City so she and others would not suffer the same fate as her son Pee-wee did. As many of you may or may not know, as a matter of policy at that time, police employees were strictly forbidden from fraternizing with convicted felons. So I was a bit nervous at first. But what evolved over the next few years was the most amazing partnership I ever had in 29 years in law enforcement. Ms. Temple and the Kansas City Nova team evolved in one of the most effective intervention and messaging partners to impact violent crime in Kansas City. We helped Ms. Temple build a 501c3 and establish a governing board, and we began to emulate a group in Philadelphia called Mothers in Charge. Mothers in Charge in Kansas City delivered messages of hope and love to those at risk for becoming a victim of violent crime. Mothers in Charge, in cooperation with KCPD, implemented a response protocol to homicide scenes. Mothers in Charge would assist us with victims' families and to help bridge the gap between the police, victims, and witnesses. Mothers in Charge became the most powerful messaging component of the Kansas City No Violence Group Intervention Strategy. We wanted to play a video clip today for you, but the link isn't working. You can go to YouTube and just look at Mothers in Charge, Kansas City, and it'll show you about a 1.5 minute short video on the amazing work that Rosalind Temple did in Kansas City. So what began with a police commander meeting a convicted felon at a crime scene became one of the most powerful partnerships that contributed to a 50-year low in homicides in 2014. In 2016, Rosalind Temple was named Citizen of the Year in Kansas City, Missouri. In 2021, Rosalind was inducted into the Kansas City Women's Hall of Fame. Her collaborative efforts can be seen in a documentary titled Uncommon Allies. Other community partners would emerge in Kansas City, clergy, ex-offenders who would lend their story and provide valuable context to those that we were trying to keep away from a cycle of violence. As I mentioned, there are partners out there who have the capacity to assist. Another one of these partners in Kansas City was the Healthcare Foundation. Through this nonprofit entity, we were able to garner significant support to fund social service workers to assist our high-risk clients. While we did not build duplicative services, our social service workers would understood the capacities of the current service providers and built for us the relationships we would need to gain our high-risk clients the services or assistance they needed. Partners build partners, right? So we needed a fiduciary, and we needed to help engage the youth that were found to be at risk. An organization at the time named Arts Tech was able to help us develop a process to manage the social workers administratively, but they also implemented an art-focused intervention program to teach life skills to our at-risk youth. There are so many avenues to support law enforcement. While many may be obvious, don't assume you are truly partnering with them. It was 21 years into my law enforcement career, yet I could not tell you the name of one person who worked at probation and parole, even though I drove past one of their facilities every single day. In violence reduction strategies, probation and parole, the Department of Corrections have the capacity to be tremendous partners in your work. And in my experience, will probably fail if you do not build these partners. At this time, I want to thank all the panelists for contributing to the discussion today, and I want to turn it back to Demetrius. I know that we have several questions from the audience. Demetrius?
Thanks, Joe. Now we will begin, next slide. Now we will begin the question and answer portion of the webinar. We will respond to as many questions as possible in the time remaining. As a reminder, you can chat your question in the Q&A box at the bottom right-hand corner of your screen. I am now going to turn the webinar back over to Joe to moderate the question and answer portion.
Thank you, Demetrius. So if we could start with Chief Skinner, and just a reminder to the panelists to unmute. Chief, can you describe how the efforts began? I know it's been a couple of decades up there. Were they started by the police department, or were they started by the community-based partner up there?
That's a great question, and again, that was 31, 32 years ago, and I won't have the direct knowledge of how that happened, but it was my understanding that the social service provider Whitebird, which they provided just an array of social services for a variety of people in the community, really recognized this gap or this need to do something different. And the police department was responding to these things the very best they knew how. And think about law enforcement 30 years ago, the types of people that we hired and really what the core of the mission was for law enforcement. I mean, if you think we're not equipped to deal with behavioral health issues now, think about 32 years ago. I just finished my 30th year. And so I think about 1990 when I started in law enforcement. That certainly was not a focal point of my training. And so the Whitebird Clinic came alongside the Eugene Police Department and basically said, hey, what do you think about having us respond to some of these things? And my understanding is the police department, obviously is going to take them up on that. I mean, if I went to any police officer today and said, hey, what would it feel like to not have to respond to an illegal camping complaint of a homeless individual or a behavioral health issue where we have another service to go? Every police officer in this country is going to raise their hands and say, sign me up. And so it really was a very kind of grassroots, organic genesis for this program that has kind of stood the test of time 31, 32 years later.
Thanks so much, Chief. I remember too when I started, you had your car keys, you had a clipboard, and a wooden stick. And that was pretty much your tools to start the day just 30 years ago. I'm going to have the same question for Caroline that I just asked you, Chief. But before I go to Caroline, what would be a good way for a community-based partner to contact the police department to discuss a possibility of a collaboration?
Yeah, that's a great question. And, sometimes our police departments are really hard to know kind of where's that critical input that you can kind of get your hooks into a police department, and a lot of it depends on the size, quite frankly. Joe, it's just, as we know, if you're trying to get in with a, LAPD or NYPD versus, Eugene Police Department, it might be a little bit different. One thing that I would say, though, is that partnerships like this don't work unless you have a commitment from the leadership from the top, because there's a lot of effort into this. Not only is it financially important to be committed, but it's important to be committed from a relational perspective. And so, like you heard throughout this webinar around building relationships, there's a certain amount of investment, like in all of our relationships, whether they're professional or personal, quite frankly, there's investment that needs to be made in these relationships. And if you don't have the buy-in at the top from the leadership that says, this is important, this is the right thing to do for our community and the gaps in our community, then these partnerships are really, really going to be hard to sustain. And so what I would say is you may reach out to a command staff person or a lower level person, but eventually what you want to do as a social service provider is you need to get in the room with the leadership, and you need to start that relationship and make that commitment to the commitment to investing in the relationship together. And that's really a good way to start that.
Thank you so much, Chief, and thanks for your leadership. And I'm going to turn to Caroline now, and Chief Skinner just related. It takes the top leaders of the agency, and I know at Chattanooga PD you had Chief Fletcher, you've got Chief Roddy there now. Can you talk about how your partnership started there in Chattanooga? Was it truly the vision of the police chief and the administration at the time, or was there a community group that was pressing for the change?
Yeah, thank you so much for that question, Joe. I would say that particularly for law enforcement-based victim services, to both yours and Chief Skinner's points, that executive leadership from the top down was necessary and critical. And I would say it absolutely was Chief Fletcher's vision to bring in law enforcement-based victim services. I think, in having worked out in the community previously, I knew that a lot of advocacy groups or community organizations knew that they wanted their relationships with law enforcement to change. But when you're in the community, it's very different than when you're working within the system. And I think, to kind of use that phrase of when I was in the community, I didn't know what I didn't know. I knew I wanted things to change, but I didn't know what that change could look like, what the access points were, or how to even go about that beyond just, we're having, an awareness walk. Please send someone from command staff to come and join us, versus what does it really look to strategically partner in different ways. And so I think having Chief Fletcher and now Chief Roddy be in that executive position and really envision differences for their own agency from the inside out were critical when we began victim services. And, from the very first day that I walked in the door at CPD, I was treated as a valued member of command staff, quite honestly. And I know some folks might have their feelings about that. As a professional staff member, that's the term we use. We don't use the term civilian, we use professional staff, but a civilian essentially being treated on the same playing field, essentially, or being called upon for insight like a sergeant, lieutenant, or captain would, and being publicly called on for their insight and publicly valued by executive leadership. Some folks, felt like I hadn't earned my stripes, if you will, to have that ability or that platform, but it communicated to the entire agency that victim services was a valued aspect of our department, and we were to be treated with that dignity and respect that we were asking even our officers to treat victims with. And so our executive staff modeled that in just how they treated me when I walked in the door. And I think for folks that are looking for ways to change those partnerships is, how do we treat each other internally can also impact how we treat each other externally. And so if we are healthy as an organization internally, we're going to be healthy for the folks that we're serving out in the community and for our partners externally as well. And so, to sum it all up, I think executive leadership matters tremendously in how you set the tone for your agency. And for folks like Chief Skinner or Chief Roddy or Chief Fletcher, I think that had I had different leadership, I don't know if maybe we would be successful. I can't say what it would have been like, but I certainly think that none of this would be possible without their vision and without their implementation in these efforts.
And I would add your leadership and
Thank
your
you.
passion for what you do, Caroline. You're absolutely amazing. Just working with you through the National Public Safety Partnership. Thank you for all you do for Chattanooga. And just a follow-up question. Confidentiality, in dealing with police records, that's always a concern. Can you maybe just talk generically about how you address confidentiality concerns in the role that you play?
Yeah, that's a great question. So, my understanding is that systems-based advocates, with the exception of the great state of Arizona, do not have confidentiality when you work for a government entity such as a DA's office or a law enforcement agency. And so how we go about the issue of confidentiality is upon our initial conversation with the victim, survivor, whether it be through in person or on the phone, depending on how that referral comes into us, we explain confidentiality and the limits of it. And so essentially what we receive is informed consent to participate and engage with that victim. Let them know that we work for the police department. So if you tell me something that has investigative value, either you can tell the investigator, I can tell the investigator, or we can do it together. But I cannot withhold things from that investigator. And if you're wanting that confidentiality, I can refer you to an agency out in the community that can provide you with that, and we can end our service relationship. So what we have found is when we inform people of that confidentiality and the limits of it on the front end, we have found that people want to continue and readily continue to engage with us. We were not sure what that would look like. We would think that most folks would, we were worried that most folks would say, well, I don't want to talk with you. But most folks, I think when they are presented with that information and then continually given the option to opt into services or withdraw that consent at any time, it goes a long way because it's an exercise of trust when we inform them of that. And so how we document is very specific, and I'm happy to send some resources. We are very mindful of documentation in regards to things like Brady disclosures. How we document is very service oriented and not investigative at all, because we don't want to do anything that inadvertently violates suspects' rights, honestly, as well as undo any of the good work that our investigators have done. So there are absolutely some really strategic and nuanced things that you have to do when you're building a victim services unit from a police department perspective. It's not impossible. You just have to really make sure you're paying attention to some of those factors. But that's a great question. I appreciate it.
Thanks, Caroline. We're going to give you a quick break, but I'm going to come back to you in a moment with two more questions.
Okay.
I'm going to go to Dr. Novak. Ken, I'm a police agency, I'm in management at a police department, chief, deputy chief. I'm looking to find a research partner. Tell me where to start.
Sure, thanks, Joe. It's sometimes a bit challenging to identify the right partner. Certainly if you are a police commander in a college town, or maybe with a university close by, there may be some really good researchers in the social sciences and sociology, criminal justice and criminology, public administration, all of which could have the skills and absolutely the interest in trying to partner with the police in their efforts. Aside from that, there are also a bit of a network of researchers. The Center for Evidence-Based Policing out of George Mason has a list of people who have partnered with police departments in the past. That would be a good resource. Or if you have another police department that you're aware of that has engaged in these relationships, they would be a good place to talk about the pros and cons and the growing pains sometimes that every partnership has, and that certainly includes researchers as partners.
Thank you so much, Ken. We'll go back to Chief Skinner now for a follow-up question, Chief. And I believe this is questions coming from somebody in Oregon, and that it's Oregon specific. And the question is, when 988 goes into effect in 2022, will calls for service still go through 911 for assistance with mobile crisis?
That's a good question, and one I'm not going to have the answer to. We are pouring through new legislation right now that is many of which has not seen the governor sign yet, and so I don't know if that's one that has been signed or not. But I do know that that's on the horizon. I don't know if it's going to be funneled through our PSAPs or not. And as I kind of alluded to earlier, there's kind of different ways we can do this to meet that criteria if that's the case, while still deconflicting. And we're entertaining those things, but I can't speak specifically to that until we get a chance to have the governor sign it and take a look at an implementation date and build a strategy around that.
Thank you so much, Chief. We'll go back to Caroline now. And Caroline, we had a question from one of the attendees about, are the Victim Service Unit in Chattanooga, is it FASD informed?
I am not familiar with that acronym. What, can someone clarify FASD? Sorry, I'm not familiar with that one.
I am not familiar with it either. FASD, I'm not familiar with that either. So victim support FASD informed. So I do not have any further than the question from the audience, but thank you, Caroline.
Sure, I'm happy to learn more. If anyone wants to send me that, I'd love to learn. But if I don't know what it is, I'm going to go ahead and say we are not FASD, or maybe FASD adjacent. I am not familiar with that acronym, but we'll always be willing to learn more. If someone wants to send that to me, I welcome that.
Thank you so much, Caroline. And then the last question was actually, I think, directed toward me, and it was, actually, there's two more questions, one more for Caroline, but I'll come right back to you, Caroline. They asked about Mothers in Charge and that if the members of Mothers in Charge actually responded to the homicide scene. Yes, they did. They were notified by the homicide squad that was responding to the scene. They were called by a detective, and they did respond immediately. They did not become part of the investigation. They remained outside the tape. They were only there to engage as a private entity with the community. And to go back to, and this will be our last question because we're coming right up on 90 minutes, and this will be for Caroline, and it's coming from an advocate at municipal court. They're wanting to help victims of violent crime prior to seeing them at court. And a lot of time will pass before they meet with them. And they're traumatized. I know that's a big question, but maybe just a quick hit at it.
Sure. So I just wanted to ask for clarification. They're asking, how do we bridge that gap between our unit and court? Is that the
Yeah, so they're a victim advocate, and it looks like there's a pretty significant time lapse, between
Sure.
them seeing the victim and them going to court.
Yeah.
Just any guidance there.
Sure. Yeah, I think that's a difficult one. I think because what I'm assuming is that this attendee is probably working in a community that doesn't have law enforcement based advocacy. And so that would make sense that by the time that victim's getting to court, there's been a significant lapse. I would maybe see, and perhaps they've already done, is seeing if there are community-based programming that could fill that gap in the meantime. A lot of times there are for domestic violence, sexual assault, children's advocacy, but what I have found in my experience is that there can be a gap in service for specific crime types, such as homicides or robberies and burglaries, where those are certainly very traumatizing, but maybe just not recognized as readily by the advocacy community as needing support. And so I would imagine that there are some pretty specific policies and procedures that would dictate this advocate's guidelines around when they can contact folks, but maybe it's also one of those things where they could look internally at their own agency and seeing when is the soonest available or quickest time that I could contact someone versus waiting till court. Maybe there's a legal reason, but maybe there's not. Maybe it's that idea of like, well, this is the way we've always done it. And so internally in our own agencies, if we leave our policies and procedures to go unexamined, we might be missing opportunities because it has become common practice. But then, of course, if there is a legal reason as to why someone can't proactively reach out to a victim, I certainly understand that. So perhaps there's some internal, if folks are willing to go there, I think there's some internal work that could be explored, but then maybe identifying some of those external partners that in the meantime could act as that stopgap between, essentially the call for service or the initial incident and that victim coming to court. But that's a tough one. So
I knew it was big, and you did
It's
great.
yeah.
Thank you so much.
Yeah.
And we're right at 90 minutes. Thank you to all the panelists, for everybody that joined today, and especially the attendees. Demetrius, I'll let you bring us home.
Thanks, Joe. This webinar was perfectly timed. We are exactly at 3:30. I want to thank all the participants for your wonderful questions, the panelists for your amazing responses, and Joe for moderating us and walking us through that. Really appreciate it. Finally, as you can see from this last slide, and if you haven't done so already, we really encourage you to join the CSG Justice Center newsletter listserv. Not only is it a great way to learn and about funding opportunities such as the GMHCP grants, but you will also receive information on upcoming trainings and resources from our agency and our partners. I also like to remind everyone that this webinar has been recorded and will be posted along with the slide deck on the CSG Justice Center website event page. If you have any follow-up questions about any resources or materials that came from this webinar, please feel free to contact me at the email listed on your screen. And finally, again, I want to thank you all for joining this webinar. And I want to thank the panelists. I want to thank Joe. I want to thank everyone at IIR for your support. And have a great rest of your day. Take care, everyone.
Thank you.